So, breathing and airway have become a really big part of my practice and always evaluating patients for any sort of issues when it comes to airway or breathing. And that's because over the past 5 to 10 years, we've really started to understand how important it is to breathe properly. There's a really great book called Breath by James Nestor that I really love and I recommend to patients. It's easy to read and it really touches on how impactful proper breathing is. For me, adults, children, uh, anybody can really benefit from breathing better, breathing properly. So when I look at patients, often questions I'll ask them is, are you snoring? Are you breathing through your mouth? Are you breathing through your nose? Do you wake up in the morning with a dry mouth? I want to get an idea for what their practices are. I'll look at things like the roof of the mouth to look at the rise of the palate. That might give me some sort of indication to how the person is breathing. With kids, I'll often look at their face, look under their eyes, look for bags under their eyes or any sort of dark circles, which indicate kind of poor oxygenation. These are things that I think it's really important as a biologic dentist to really clue in on because, again, it's sometimes our physicians or primary care folks might be missing these really important parts of our daily life. So we understand that on its most simple level, that breathing properly through your nose will stimulate nitric oxide release in our bodies, which helps to lower things like blood pressure. But when it comes to things like sleep apnea, we also know that that can impact things like metabolism and weight loss and also cognitive function. And in kids, I'm actually really passionate about breathing because proper breathing impacts their growth, not just cognitively, but also physically. So, with proper breathing techniques, lips closed, breathing through your nose, and tongue on the roof of the mouth, that actually stimulates growth of the maxilla and the mandible to grow properly so that there's room for the tongue, room for the teeth to come in, and that their body is functioning properly. So these are things that I'm always looking for. There are things like mouth taping that I talk about a lot. So mouth taping is a really simple and easy thing to try. It's almost like a diagnostic tool sometimes to see how you're breathing and if you can actually breathe through your nose at night. So I tell patients, take a little piece of medical tape, or you can buy mouth or lip tape online, and try it out at night. See how you feel in the morning. See if you were able to make it through the night without ripping it off. If I have a patient who says, I just couldn't breathe through my nose, then I usually send them over to the ear, nose, and throat doctor because we really want to know if there's any sort of obstruction in their nasal passage or the back of their throat. We want to look at the volume of the airway and making sure that there's no sort of physical kind of obstruction that is preventing them from breathing. Sometimes I'll work with myofunctional practitioners, and these are folks that help people kind of position their tongue, their lips in the proper position so that they're chewing and they're breathing better. I'll also use little tools like the Myo Munchie, which for kids is a really great little mouthpiece that helps kind of stimulate growth of those jaw bones, but also encourages that nose breathing. So I think this is a really important thing that I talk about with patients all the time. I tell them to talk with their significant others, to watch their children. I think this is so impactful just beyond the mouth, again, to the rest of the body. I think we could be living better and longer and healthier lives if we're breathing better.